Okay. Go ahead and get gloved up here.
Applying the tourniquet.
Oh, making sure you get your little tail out the way. Okay. You drop your hand up a little bit. Right up in here.
So they got it last time from the procedure.
Yeah, right here. It went away. There it is. Right.
Sometimes making a fist can make the vein bulge.
Yep, there it is. I see it. If you take your glove off, get a new one.
Mm-hmm.
All right. Got all your supplies setting up, including when you get a successful stick, you got your tape ready to go. All right. I'm gonna make sure you anchor it down. Make sure your patient is being as still as possible. Are you gonna look?
Mm-hmm.
There it goes. And you lower it, and you advance your. Okay. Make sure you're holding pressure above.
So she's gonna draw some blood work from me initially.
It's not really wanting to pull back a whole lot.
Some.
I might want to just let go. So, and sometimes these 22s don't like to give back a whole lot.
They're so small.
So you might get a draw out of a 22, you might not. So if not, just go ahead and get your thing ready to flush here. Still keeping it on your sterile. Oh, there it goes.
So she held pressure above to prevent it from bleeding out while she was changing out.
Yeah.
The tourniquet is released before she flushes.
Yep, and I'm not meeting resistance when I flush.
And she flushed
Okay.
about 3 milliliters.
Yep. So the next thing we're gonna do is we're gonna take our tape.
And I can taste it.
And you can taste it. Some patients do report being able to taste
Or smell.
normal saline. So what I've done is I slide a piece of tape underneath, and I'll do a close-up in just a minute, and I go ahead and I fold over, because it folds over the wings on the catheter.
If your needles have catheters, depends on the manufacturer.
Depends on the manufacturer.
I do the same thing.
So, hold that. You go ahead, put your Tegaderm on, taking care not to do what I nearly did, and put it right over the hub. Thankfully, this one has a nice little notch.
Little opening.
So, okay. You go ahead and take your paper off. And don't write on your patient. Take this right here, you lay it down, and you write it on a piece of paper. Then you take it and stick it on your patient. And what is on here is date engage, and your initials. Okay? Cool. Yay. Well, it draws back from here.
And now that she has it secured, she's flushing again to verify patency a second time.
Yep, just to make sure that I did not, when I was dressing it, move it. So,
And
then we go ahead, we'll clamp it off. Unscrew, do not leave this attached to your patient after you're done. And I would normally, at my facility, they recommend that we get chlorhexidine caps, which are provided. They're usually green or bright orange. Again, check your policy, okay? And if you don't have a cap, you will, prior to touching anything on this, alcohol swab.
so this is when you come back later to draw blood.
Okay.
You can go ahead.
All right. So I'm in here. Hopefully it'll draw. So,
But you would.
I would what?
I'm just saying.